All right, well, welcome everybody to my session. I'll be looking at a dynamic exploration into the diverse needs of our NHS people and talking to you a little bit about how we've actually managed to support all 1.3 million of our NHS staff by offering a health and wellbeing offer. So please move to the next slide. So just by way of explanation, my name's Cheryl Samuels, as I said earlier. I'm Deputy Director of Workforce Transformation for the London region. But prior to this, I was one of the national leads for managing health and wellbeing for the whole of the NHS. And so I'm very well placed to actually talk about what we've done here. So if you've got any particular questions, feel free to put them into the chat box. And some of those things may well be picked up as part of the presentation or as we move throughout. So we move to the next slide. So the objective today is really to outline the award-winning NHS and wellbeing offer that we've put in place, to review the rationale and how we managed to actually put it together, to talk a little bit about the mobilisation of staff, and also to talk about the dynamic approach that we considered and ensured that we put in place to meet the diverse needs of our workforce. And hopefully some of this will start to prompt some thoughts and views around your own health and wellbeing offers, and starting to think about just how dynamic those are and how much you've really been able to support the needs of your workforce, given its diversity. Next slide. And in addition to that, you'll be able to start to think about what the gaps are as we approach, or we're actually in the second wave as it stands at the moment. So what does it mean to have a dynamic health and wellbeing offer? If you can press the next two buttons. So dynamic really is it's defined and characterized by a constant change or an evolving type process. So I guess the question is whether when you were pulling together or thinking about the health and wellbeing offer that you had in place, how much do you feel it was evolving and constantly changing to meet the needs of your workforce, noting the changes that were constant and the changes to government rules, government guidelines, and also as we learnt more about the virus as it went on. Can you press the button again? So I think the thing that is actually really key about the offer that we had in place and currently have in place is that it's an evolving health and wellbeing offer, and it's been curated based on the most up-to-date evidence to meet the needs of a culturally diverse workforce. Next slide, please. Oops. And sorry, just also, naturally, good health is an important focus. It's not just about sickness absence, and we were very clear at the outset to actually really focus not just on the absences and the reasons why people were away. We wanted people to thrive, not just to simply survive in these difficult times. Next slide. Okay, so the first poll that I would like to run is, given what I was just saying about a health and wellbeing offer that actually is evolving, changing to meet the needs of the current circumstance and the latest evidence, how dynamic do you think your local health and wellbeing offer has been? If we could probably put the poll up. and if you can pick one of the options I've got there, so either you think you had a very dynamic and inclusive one that meets the basic requirements for most of the workforce, meets some of the needs but not the diversity of the workforce, or that you think it was very basic. So is everyone able to go to the polls? The poll is under the poll tab over on the right hand side of your screen. So it'll be interesting here to see whether or not people feel they've actually had a dynamic and inclusive offer, or whether they think they've had to work really quickly to pull something together and that it's quite basic in nature, and there are opportunities to improve the offer that you have in place currently within your organisation. Okay, interesting. So we've got 25% of the votes think that they've got a very dynamic and inclusive offer. So hopefully as we go through the session, you'll be able to look at what we've done and probably compare and see whether or not there are any gaps as to where you may well be able to strengthen your own offering. And then we've got 45%, which is the majority, that feel that it meets the basic requirements for most of the workforce, but maybe not sure it actually meets some of the specific needs for some of our diverse groups, and meets some needs, but not the diversity component. That's to be not surprised by that. And we've only got one vote suggesting that their wellbeing offer is very basic. So I guess from that we can see that there is an opportunity to review the current offer and look at where we can strengthen it further. So can we have the next slide? So noting just how dynamic we think our local health and wellbeing offer is, I'm just interested to know exactly how you're actually measuring the effectiveness of your local health and wellbeing offer, and whether you are using any of these mechanisms for measuring the effectiveness, or whether you've not yet got round to actually evaluating the effectiveness. So if we can just run the next poll. Oh, fabulous. So if people can click on any of those and let us know, or which is the main method of feedback that you're actually using to measure the effectiveness of your local health and wellbeing offer, that'd be fabulous. So give it another 5 seconds. Can I assume everybody's probably clicked in and made a choice? So let's have a look and see what the polls actually tell us. It's always quite interesting to look at whether or not we measure the actual offer that we're actually putting out for staff, and knowing whether it's really making a difference and whether it's really hitting the mark. And that's part of some of the work that we did, was actually to make sure that we were reviewing and getting feedback from the system regularly to actually understand whether or not it was actually hitting the mark. See if we can get the results. Oh, there we go. So hopefully everyone can see the results there. So looks like the majority are actually using local pulse surveys. I'm surprised we haven't got so many that are actually looking at the any sort of internet type web-based resources that you will have had, and not actually looking to see what the traffic looks like. qualitative interviews, I'm not surprised there might not be so many, because not everyone's got the capacity to be able to do that, and helpline data. Let's have a look. And only 11% said that they're doing all of those things. But we've also got quite a percentage of people there that are saying they haven't done any of these yet, or they've not agreed the evaluation methodology yet. Okay, so that's really good. That gives me a bit of an idea as to where we're at. So can I have the next slide? So you might need to make click those through, press the button so the other bubbles appear. So I think the case for improving health and wellbeing is really well made, and I think that COVID-19 has really amplified our need for a health and wellbeing offer. And furthermore, I think that it has also solidified the importance, and that's been brought into a much sharper focus than ever before. So I think that we know that from a series of resources and a series of people, that we know that the cost of mental ill health in the NHS equates to between £1,700 to just over £2,000 per employee. So the return on investment in terms of actually investing in health and wellbeing is really well made. And we've even had Dr. Justine Varney, who's actually said staff health and wellbeing is one of the most fundamental pillars of productivity, recruitment and retention. So we knew that during the course of the pandemic, if we didn't treat staff right, they absolutely weren't going to be able to deliver on some of those key and core components. So all of this we viewed as caring for our NHS people. Can I have the next slide, please? So I guess being aware of the importance of health and wellbeing and the case having been made, we already had a substantive team that was already in place that dealt with health and wellbeing. And subsequent to that, we decided very early on to actually mobilise a team of staff to actually support the pandemic. And that was pulled together with Prana Issar as the overarching executive lead. And then we had M. Wilkinson Bryce as the senior lead, the CIRO, as we call them. And then we had Dr. Sonia Wallbank, who was the clinical psychologist that underpinned the wellbeing offer with the psychology component and led the programme with the support of senior leads like myself on various aspects. So I guess what this really just sets out is that she established something called the PAR model. So some of you may well have seen this before, and essentially that was about anticipating the peak of the demand and making sure our staff were prepared for it, but also recognising the emotions that our staff would be exhibiting as we go through the different stages of the pandemic. So obviously, as we were preparing to go into it, people were starting to worry about their own safety. They were just thinking, oh my gosh, what am I going to be asked to do? Have I really got the right skills? Am I going to be able to do it? Where are they going to deploy me to? What if I make a mistake? What's going to happen? So there were lots and lots of anxieties that were starting to surface at the very outset as we were preparing to go into the pandemic. And then as we went into the very active phase of the pandemic, the demands that were being placed on people really started to reach their peak, and the intensity and all-consuming nature of trying to juggle work and home and to do both of those things well clearly started, and we knew it would start to take its toll on staff, and that they would need some support around how to actually manage the fact that they're so focused on everybody else and looking at their own safety and the safety of their own families, that they would need some help in trying to manage that, not to mention the fact that we knew there were going to be a high proportion of deaths, and therefore we needed to manage our staff's responses and expectations around trying to manage some of the guilt and the remorse and the worry that we knew that they would feel, together with the fact that once we came out of the pandemic, we thought we were then going into recovery mode. And that's where obviously people have come out the other side of all of that and thinking, gosh, I managed to get through all of that. They really start to reflect and review and think about what they've actually just been through, some of the tough decisions that they will have had to have made, but also feeling guilty in some cases that some people survived and some didn't. It's not normal circumstance for us to lose colleagues at that type of rate in the workplace, and that in itself, the bereavement aspect has been really challenging for staff to manage. And so the moral injury, together with the survivor guilt, has also made it quite difficult, on top of the fact that everybody is really feeling very fatigued. Can we go on to the next slide? So, noting the fact that we had the clinical model, we then had the major part of how we pulled it together was that we very early on started to engage with the major incidents, or start to look at all the major incidents that had happened previously, who some of those experts were, and linking to other experts in the field, noting the clinical underpinning. So we linked with people that led on the Ebola outbreak, the 9/11 bombings. We engaged with the army because they're obviously working with, they're used to leading in a crisis, and we knew that there were lessons learned that we could pick up from there. We had the SAGE members, we had clinical psychologists, we had resilience experts, we had Michael West, we had Manchester bombings, people that had been part of the Manchester bombings, both from service in the hospitals who responded to that, as well as many others, including with that we also had our trade unions and professional bodies. But in addition to that, we also did link with the other nations and sought expertise and thoughts and guidance to help shape some of the work, but also looking at what all the leading edge information was and all lessons learned from previous incidents, because we knew the reality is that we were going to be what we were going to go through was really going to be impacting us. And what we wanted to do was to ensure that the support that people had was appropriate so that they could process the impact and limit the negative impact, reducing the need for specialist intervention at a later date, and ultimately reducing recovery time. So can I go to the next slide? So in terms of the National Health and Wellbeing offer that we put together, I've kind of summarised it here in the simplest way forward, and happy to pick up any questions as and when they arrive. But essentially, I led on the psychological component and looked at the psychological health and well-being of our staff. So that concentrated on sort of the anxiety, the stress, sleep deprivation, all those sorts of things that people were worried about. And as a result, partnered with 7 app companies and provided free access to all NHS staff and partner organisations. So there are people like our porters, for example, who actually work with us and are integral to us running the hospital, but are not necessarily directly employed by us. But we ensured that they had access too, because we knew that the porters would be seeing a huge number of people that were dying, and it was more than normal. Not to mention that they would also be dealing with people that they may well have known as well. So we released the apps into the system. We put some national support lines in place. So we partnered with the Samaritans, and we also had Hospice UK as well. And then we also had Shout, the text line, so that there were dedicated national support lines that people could access for support and help that was independent of their employer to support them. And in addition to that, we also had some online guides and leadership tools and support, because we knew that people would be leading within a crisis, and actually the skills and expertise that are actually needed would be slightly different than what they're used to. And it was looking at how to support those people to do the best by their staff, and to help the services to keep going, as well as actually caring and being compassionate in recognising that this virus was impacting all aspects of our staff and their lives. We also set up a dedicated microsite, which is www.people.nhs.uk. And within that, we had bereavement support, we had childcare resources. We also set up virtual debriefing spaces, which we call common rooms. And those rooms were set up for different groups of people that made it more comfortable for people to be able to debrief appropriately in those spaces. We also ran a series of weekly webinars, weekly wellbeing webinars, and those we had experts like Neil Greenberg, Michael West. We had a whole range of people that actually came on and talked about different topics, different issues, and things that were all pertinent and relevant to managing the crisis, but also supporting our staff as best we could. We also put in place some financial wellbeing webinars and partnered with the Money and Pension Service, and we've been running a series of financial wellbeing webinars every other week, and they're all tackling different issues, from gambling to managing your money effectively, to people looking at how to budget, and also preparing for some of life's events and the financial implications and impacts that staff may well be doing, but trying to help people to be fairly savvy with their money at what is quite a difficult time. We also then had Silver Cloud online training resources, and we also had some good sleep guides and personal resilience type interventions. So the programme team really responded positively to the evidence that was out there, and noting the PAR model. And with that, we also then noted very quickly into the pandemic, we noticed the disproportionate impact that was being felt by people of BAME background, and realising that they were more at risk of contracting COVID, and as such had completed an equalities impact assessment for all the programmes of work that we had underway. And then we developed a refined offer, which continues to evolve. But essentially we set up a Tagalog line for Filipino nurses, because when they're actually in distress and upset, sometimes it's easier to be able to speak in your native tongue, and to be able to debrief in a safe space, in your own language, to support them at that time. And also because some of the staff were dispersed, it was an opportunity to be able to bring them together so that they felt supported. As often people that have come here to work, their family becomes their work family. So it was important to keep those connections together. So we had a dedicated bereavement line for them. And in terms of the apps, we'd actually commissioned Liberate Meditation, that was a culturally sensitive offer, and offered diverse meditations, and that was to support the BAME community, recognising that people were not able to go to wherever their religious place of worship was, or that they weren't able to go and see family or extended family members, and because the networks weren't as tight, because they weren't able to go out due to the government restrictions, this was an alternative and an additional support measure that we could put in place to support our staff. And then we also had some culturally diverse common rooms. So we actually had some common rooms that were specifically for people of BAME backgrounds, and for them to actually be able to engage and debrief, because some of them, and given the volume of deaths, they clearly needed to have a space to be able to talk about all that they were experiencing and what they were feeling. And we've also pulled together culturally diverse bereavement guidance for managers, and that's really to talk about the fact that we recognise the volume of funerals that have been had this year is unprecedented, but also lots of people haven't been able to really grieve in the way that they would normally, and not to be able to actually fulfil all the normal rituals they would normally do that form part of the grieving process. And what's very clear is that not all managers realise that in different cultures, the way in which we grieve is different. And so there was a real opportunity to do something different there, and to educate and support our managers to actually be culturally sensitive and competent when having conversations in this space. Next slide, please. So in terms of how useful the offer is, we know that we have lots of staff that are accessing the system. We've had over 10% of the NHS have actually downloaded one of the 7 apps that we've released into the system, and we've had testimonials from staff telling us how it has really helped them. We've actually had, in terms of the helplines, we've had just under 10,000 contacts throughout the dedicated helplines. In terms of tweets, we've had over 16,000 views of the People website. And in terms of the number of Twitter impressions, we've had about 31 million. And things like the leadership circles, we've had 2,750 of those, where people have actually gone in to actually really understand how they can actually lead compassionately and with a degree of expertise that means it's more meaningful for the staff who are on the receiving end and working in quite difficult circumstances. And the common rooms, we've got just under 1,000 people that have accessed those virtual debriefing spaces, not to mention lots of the other things that we put in place. So our national health and wellbeing offer is designed to augment the local support in place, and staff are continuing to access that, together with lots of the other guidance, which for ease, I've just kind of I thought it'd be helpful just to signpost to the fact that we'd also pulled resources together around suicide support, childcare resources, and linked with city parenting. We'd also been lobbying the government behind the scenes to actually talk about how parents in the NHS were going to be able to attend work to support the wider population, but also manage their parenting responsibilities in terms of childcare. We had parental guidance. Some people were just not sure how to talk to their children about COVID-19. Children had anxieties and parents needed support. We engaged with the Tavistock and we produced a short video that was really helpful for some parents in the NHS, for them to be able to talk to their children about it. And we'd also put an autism lens on the details that we provided around the parental guidance as well, so that We also supported staff who may well have children with learning needs. We also noticed sort of the spike in domestic violence, and so we'd actually pulled together an offer around that as well. And we'd also put together a CEO suite of resources, not to mention the mentoring, the leadership in a crisis, and other forms of support. So we really did look at the PAR model and look at all the different things that would be needed for each bit of the workforce. Can I have the next slide, please? So that essentially is one of the pictures, infographics that we used just to remind our staff that we had a range of guides, apps and events and support that was available to them, and signposting them to the People website. And one of the things that we did definitely take note of was to actually make sure that we used this opportunity in all our imagery to ensure that it was always diverse and inclusive, so that we felt that we represented everybody and there was an opportunity for everyone to feel like the offer was actually aimed at them and for them. Can I have the next slide, please? So I guess the other thing to say is that as a result of just how dynamic our offer was, we actually in total have won 4 awards for this work. And the person in personnel today, they said the NHS has made have been made overall winner for their extraordinary effort set against the backdrop of the unprecedented COVID-19 crisis. They were blown away by the speed of the mobilisation of the work and the clarity of focus for a project that was enormous and unique. And the value and impact of this intervention on those working in the NHS in England is clear. It was a fast-moving piece of work that was pulled together in an uncertain context and delivered in a highly stressful environment. So that is something that is great for us, that we have external recognition of that and the benefit that is actually had to the wider workforce. So I'd like to move to the next slide and would be interested to hear from you all as to what have you most welcomed from your health and wellbeing offer. If you can pick the top 3 and just put them into the chat box, please, and we can try and pull this together as a Wordle. So I'll just give you all a minute, because I appreciate I've shared quite a bit there. But it'd be good to really just know what you've really welcomed at this time from the health and wellbeing offer that you've had available to you during this time. Just noting your comment there, Kerry, about the breadth of the offer and covering all aspects of health and wellbeing. We absolutely did, because this really was touching the lives of everybody in every bit of their home life. And therefore it was hard to make the distinction between home and work. We needed to really move from simply looking at people as a resource and actually looking at our NHS people as people. Great, so looks like the apps are definitely up there in one of the things that people have really, really welcomed, the wellbeing apps. The sessions, I'm assuming that's the constant reflection that we've had throughout, and the breadth of the offer. This is really good to see. I think from most of the feedback we've had, the indication is that it absolutely that the apps have been really helpful and really welcomed, and that is mostly definitely one of the areas that will continue beyond here. So in the interest of time, I'll just quickly move on to the next slide. So what have we learned? So the pandemic has touched all our lives and illuminated many long-standing inequalities. And now really is the time to influence health outcomes for some of these marginalised groups that exist within our workforce. Employees are being looked upon holistically and as individuals, but we know that they're tired. Resilience, we know, resides in teams, and we learnt that through our interactions with the Army and some of the resilience global experts that are out there. So relationships with line managers we knew were key to unlocking and sustaining our staff, and partnering with organisations to deliver what's needed and learning from the experts was absolutely key to us being able to pull together a dynamic offer. And that means listening to our staff, but also listening to the experts and realising what actually makes a difference, rather than just simply picking initiatives or interventions that don't necessarily have an evidence base to them. And I guess the other big bit of learning is, you know, we need to be ambitious and flexible. We need to listen and respond and keep the offer evolving so it remains current and relevant. A rapid shift to online services and info has been absolutely essential. We couldn't have done it without. And the wellbeing managed well creates and fosters a great inclusive culture that leaves staff feeling valued. So we do need to think what actions we've taken during lockdown and what should we retain beyond the pandemic to build recovery and support into everyone's health and wellbeing. Can I have the next slide? And so the next steps for the National Health and Wellbeing Offer are for us to take up and continue to grow the offer and make sure our staff continue to feel treasured and supported. We need to continue to normalise help-seeking behaviour, because we know that those that need help don't always ask for it, and therefore we need to actually look at ways of actually trying to target them so that we're able to actually support them. And then continuing to work with the expert reference group and building strong relationships and stronger products that best support us as we come through the recovery phase. And to look at the role of line managers, including holding effective health and wellbeing conversations moving forward, and looking at the physical health of our staff, family and financial wellbeing, and also compassion and kindness at work. We've got some work around the Civility and Respect Toolkit that will be coming out around that, together with the violence reduction piece that we've got on the body-worn cameras, that will also be something that features, as we've seen some violence during the course of the pandemic. So I'll end by just saying that, sorry, next slide. COVID has taught us so much about health and wellbeing, as well as the diversity of our staff. And in order to truly support our staff and build inclusive cultures, we have to actively listen, recognise difference, be flexible, respond and evolve to attract, recruit and retain the best workforce at this time. So I think my time is up, so I probably haven't got, have I got any time for questions, Rachel?
Yes, we can take a couple of questions if anyone's got anything.
Okay. Has anybody got any questions about what's been presented or any of the issues or experts that we've consulted with? Hopefully this will kind of give everybody a bit of food for thought in terms of reviewing your own health and wellbeing offer and thinking about some of the other areas that you might want to focus on when looking at your staff as people in their entirety and how you might help them. I see we had David Grantham who commented a little bit earlier as well about the mental health and wellbeing approach and the peer support. We absolutely did really go big on the mental health piece, recognising that our staff don't always feel able to seek help, and it was trying to look at ways of actually trying to reduce the stigma around mental health, and recognising that that stigma exists outside of the organisation but also internally, and it's looking at ways of trying to break that down and making it easier for people to access help. And so that meant thinking about our language, the things that we say, the things that we do, and how we make those things available to our staff. And also it's particularly difficult as well with some of our clinicians as well, to be able for them to feel comfortable to declare mental health worries or anxieties. And peer support absolutely was key in all of that. Oh, and that's lovely. Thank you, Karen. The programme was massive and is massive, continues to be, but we're supporting 1.3 million staff across the country. So it needed to be really big and it needed to be available because we knew that different size organisations were able to offer some health and wellbeing offers, but there are some things they would never have been able to mobilise at scale or to be able to leverage the amount of support that we were able to actually put in place locally. And it made more sense to be able to offer that consistently across the NHS. So that it was consistent, and also it started to close the inequality gap because it meant that we're actually offering it to everybody rather than just sections of the workforce. So, but evaluating the impact of this has absolutely been key, and it's been great to get the external recognition for the work via the awards. So Amelia's asking, how do I see us sustaining momentum with health and wellbeing? I think now that it's shot up and it's front and centre, I think organisations are very much starting to realise that it's something that can't be ignored. And I think that our staff are actually more demanding of that. And I think that as we move forward, I think the workforce will be expecting their employer to be thinking more broadly about their health and well-being, which is not just physical. It is the emotional side. It is the mental health, the psychological side of things, as well as the physical. But not to mention even just the financial well-being. So I think we're in no doubt. We've moved into different times. And I think that the inequality gap and the impact it's had, I think is very stark, and I think it will remain with people for a very long time, and really does need to stay very conscious for people. And I think that is the thing that will start to normalise it, where health and wellbeing will become integral to all that we do. Thank you, Liz. Just noted your comments. Nice to see you. And there's definitely much more for us to build on from here, from all that we have learned. And we've really got to use this opportunity to reduce the inequality gap and not forget the wider NHS family as well. And we certainly didn't forget them during this time, because at this time we needed everybody. So that was our contractors, it was primary care, it was secondary care, it was public health, it was everybody. And we recognised the contribution that everybody made and tried to make sure that all of them felt valued for their difference, but also for all that they bring. So I think we might have, how long have we got left, Rachel? Is there a few more minutes left?
A couple more minutes and then we'll be back on main stage at 1:45.
Okay, so we've probably got another 4 or 5 minutes. So is there anything else anybody else wants to query or ask? It's been really lovely to have so many of you today here to hear about the National Health and Wellbeing offer that we put in place. It's really great to see so many people were interested to hear what we were actually doing. So thank you, Trish. That's a really good question. So Trish is asking, what were some of the questions you put to leads on major incidents for leaning into this work? So some of the questions I think that we actually put in was, one was actually noting the PAR model. I guess it was starting to think about what is it that staff are likely to think, what are they likely to start to feel, asking them how is it that some of those feelings start to manifest themselves in the workplace, what are the typical things that people started to see, and what were some of the patterns within the workforce that people started to see when some of these incidents took place. So I think we spent quite a lot of time trying to understand the journey from preparing to go into what some people may well have described as going into battle, if you like, at the start, so preparing for the pandemic. But then actually once it got to the active bit, what were people going to be thinking and feeling? What were they going to be left with? What sort of things did we need to consider? And we noted the impact on the economy, and just wanting to kind of understand what sorts of things we might want to put in place once we'd fully understood what happens when people go through a major incident. So we got lots of learning from that. I mean, one of the big learning points from that was about the fact that resilience resides in teams, and it's a phrase you'll hear quite a lot from us in the national team, because actually our staff spend quite a lot of time with their line managers, and if the team is working really well, that is where you're actually really going to see the resilience starting to, your staff and the teams themselves will be more resilient when the line management relationships are really strong. And you definitely see that when you speak with the army and some of the people that were part of the Manchester bombings and the Ebola crisis. There were some commonalities between them all, and that's how we were able to actually really try and start to work out where we needed to focus the offer, and what interventions and things we might want to put in place to support our staff. So I hope that answers your question there. What else we got? So Joanne says, really interesting about encouraging people to even talk about mental health. In Northern Ireland, our culture is definitely not one of asking for help, so that's a big challenge for us. So Joanne, we were actually linked with Northern Ireland as well. So Dr. Sonia Wallbank, we actually met with all 4 nations, and so some of your offer is very similar to ours. For that reason, as it's also underpinned by the PAR model. So we shared expertise, knowledge and skills across the board. And I think that the whole not talking about mental health, I think, is a big issue, which is why we had links with Mind, and we work very closely with them, and clearly we're very aware of the Thriving at Work piece, which me and my team were already doing work in that space prior to the pandemic hitting. But you're right, talking about mental health continues to be an area that we have to work on, but I think we've now got the chance to really normalise it, noting the changes in society and the fact that everybody's mental health has been impacted in one way or another by the lockdown restrictions. So thanks for that comment, Joanne. Completely agree. It's one we need to keep working on. Okay, well, thank you very much, everybody, for joining in the session, listening to the overall health and wellbeing offer that we offer to our staff. If you'd like to know more or want to comment, feel free to follow me on Twitter or to look at our the People website if you want some further information. Lovely to see you all. Thank you.